Welcome everyone to today's webinar. My name is Brooke Murphy. I am the Custom Content Strategist and Editor with Becker's Hospital Review. We will begin today's webinar with a presentation and a panel discussion, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. Now I am happy to introduce Susan Reese. She is the Chief Nurse Executive at Kronos Incorporated. Susan has more than 35 years of clinical and administrative experience and is a recognized thought leader in healthcare. Susan has expertise in technology solution development and speaks often on staffing, scheduling, and labor analytics. She is also a prolific author on workforce management issues in healthcare. At this time, I am pleased to turn the floor over to Susan to begin today's presentation.
Thank you very much, Brooke, and thank you to all of the attendees who have taken time out of your busy schedules. Our topic today is fatigue and engagement and the impact that shift work schedules can have on both. Next slide, please. So there are really three objectives I have for our time together today. The first is to define the role shift work has in creating something called sleep debt that can result in worker fatigue. Then I'd like to describe the impact fatigue has on nurse engagement. And finally, identify some scheduling practices that you may wish to consider to help diminish the likelihood of fatigue. Next slide. As we get started, I thought we should probably level set to make sure that we're all talking about and thinking about the same thing as far as shift work is concerned. So work schedules that vary by time of day. In other words, you can have schedules that are permanent work shifts, whether it be day, evening, night, or in a 12-hour shift environment, day and night shifts. Or you can have shifts by time of day that rotate, and rotations can rotate forward or backward. So a forward rotation would be a rotation from morning through evening to night. A backward rotation would be starting with nights and then moving through evenings to the morning shift. Then we have the other component of a shift work schedule are days of the week. They may be driven by fixed patterns, and some units are more amenable to having fixed patterns in terms of the shift work schedules. May be inconsistent with variable distribution patterns, which is what we most often see in the acute inpatient side of nursing units. And often include weekend shifts. We are a 365, 24/7 operation certainly in the acute care setting. And there may be an on-call coverage component to shift work. Next slide. So let's talk a little bit about shift work specifically in the healthcare industry. And most of what I'm speaking to today is related to the acute care inpatient side of the business. So nurses are very often shift workers in this environment, working irregular hours and working around the clock. As I just mentioned, 365, 24/7. There are a variety of shift lengths in play. Day of week combinations vary, and the rotation of time of day shifts are all components of shift work in healthcare. Interestingly, 75% of nurses today work 12-hour shifts. I think most on the call are familiar with the fact that 12-hour shifts are very much in the literature over the past decade or so. There's been much said about 12-hour shifts, evidence to the point that 12-hour shifts are not necessarily in everyone's best interest. Nonetheless, there are many environmental factors that have us still contending with 12-hour shifts. And as I say, 75% of nurses are working these 12-hour shifts. And we'll talk a little bit more about that later in the webinar. Longer shift lengths, some of the reasons that 12-hour shifts are so desirable is it does create a shorter work week, which is an advantage in the eyes of the nurse. However, it also it increases an opportunity to work overtime hours or increases the opportunity to work second jobs, which is a risk. Next slide. So let's talk about shift work and scheduling. Next slide. So really, there are two approaches to scheduling. There are fixed schedules where there are actual firm patterns, and there are variable schedules. And as far as variable schedules are concerned, there are really three ways that you can approach creating variable schedules. Manually creating schedules using either blank pieces of paper or Excel spreadsheets, but basically starting from scratch and building a schedule. Then there are automated generation of schedules using some sort of software solution. Even though you're using a software solution, there is still some manual intervention. When the schedule is automated in its creation, then there invariably needs to be manager oversight to ensure that indeed it is a reasonable schedule that has been created, it's a doable schedule, and also to manually intervene and fill any open shifts that are left on the schedule. And then the third variable scheduling type is self-scheduling, which is very popular, and we'll talk a little bit about the detail around self-scheduling. Next slide. So I just want to touch briefly on fixed schedule patterns, though most of our conversation today is really related to variable scheduling, but there are different types of fixed schedule patterns. These are usually most successful in units that have very defined volumes, appointment setting units where patterns lend themselves to consistency in the unit. There are a multitude of different types of patterns and plans. For 8-hour shifts, you have familiar ones are the Metropolitan Plan or the Continental Plan, where you have a certain number of days on and off, certain shift lengths. Then for 12-hour shifts, the three most popular are the DuPont, the Pittman, and the Panama plans. But as I say, these are amenable to certain types of units that have consistent volumes or appointment setting usually. Next slide. So let's focus a little bit here on variable scheduling, where the greatest challenges exist in terms of scheduling. So manually created, we just spoke briefly about the fact that this is starting with a blank sheet of paper or an Excel spreadsheet and creating from scratch. Then the automated generation, that does require some manual intervention on the part or oversight on the part of a manager to make sure that it's a reasonable, doable schedule and that any open shifts are addressed. Self-scheduling, which has become increasingly popular in recent years, it has many benefits and advantages, and it also has some challenges in terms of implementing. But talking about the benefits and the reason that people have been moving in this direction is it's very empowering to nursing. It's one thing to have someone hand you a schedule and say, this is what's going to happen for the next 4 or 6 weeks of your life, versus having someone say, I'd like you to participate in helping me build something that's going to work for you. It supports work-life balance, and work-life balance, by the way, doesn't have to be a 50-50 split of my commitment to work versus my commitment in my personal life. It's what is the work-life balance that works for the individual nurse, and having the nurse involved in scheduling enables the nurse to actually create that balance for themselves. It decreases the administrative burden on managers, and I think this is a critical benefit. Increasingly, the administrative burden that we are putting on managers in healthcare delivery is immense, and is taking away from what really is the focus of the work that they're doing, and that is the oversight of care delivery to our patients. So anything that relieves any administrative burden on managers is certainly something to be embraced. It also enhances communication and creates a cooperative community. You have the staff is interacting with one another, trying to balance out who works with who, who's covering who. So there are many benefits to self-scheduling, which is why I think it's become so popular in recent years. Next slide. So, but there are some risks associated with variable scheduling, and we'd be remiss if we didn't discuss those and acknowledge that risks exist. Certainly, whenever you have manual intervention, the risk of human error exists. And no matter how diligent any of us are, certainly error does creep into work that we do. And when we're talking about errors in staffing and scheduling, that directly affects both the nurse and certainly affects patient care. Elements of fairness. All of us carry biases, whether we choose to acknowledge that or not. Certainly if you're manually creating variable schedules, biases can creep in, and certain desirable hours can be shifted to some individuals, undesirable schedules shifted to others. We have to be aware of that. Poor attention to work-life balance. It's very easy to create a schedule without considering the impact on an individual's personal life and how that's going to work for or against what that individual is trying to accomplish in terms of balancing their life. Lack of defined rules to drive automation. Just having software doesn't solve your problem. You need to use software well. And certainly with staffing and scheduling software, it is imperative that rules be clearly defined and communicated within the software so that the schedule that the software creates is a good schedule. So just purchasing and plugging in software is not the solution. It's actually optimizing how the software is used to solve your problem. And certainly processes. With self-scheduling, it's critical that you put in place very defined processes that support self-scheduling and support the fair application of self-scheduling, so that it's not a race when the schedule opens for the entire staff to try and hit that schedule first and choose the best shifts, but some sort of a process where there is fairness in the process over time, and each individual at one time or another has an advantage in terms of choosing a more desirable schedule. There definitely is a price to pay when work schedules are poorly constructed, and that's part of what we're talking about today, is what really is the price that we're paying when we don't schedule people appropriately. Next slide. So let's talk about that, the impact of poorly constructed schedules. Next slide. So, poorly constructed schedules. The root cause of tiredness or fatigue in a qualitative study of nurses were poorly constructed work schedules. A shift work schedule disrupts sleep patterns, and this is a critical problem in nursing in particular. It is the single most frequently reported health problem among shift workers, is the disruption to their sleep patterns. I think all of us are familiar with circadian rhythms, that each of us has our own biological clock, and certainly shift work schedules can interfere with the ability to maintain our own personal clock and obtain the restorative sleep between shifts. And what happens when we're unable to obtain the appropriate restorative sleep between shifts is it results in something we call accumulating sleep debt. Next slide. So let's talk a little bit about what this sleep debt really is. If you have consecutive shifts, regardless of the time of day, whether it be day shift, evening shift, night shift, the inability to maintain consistency can lead to chronic sleep debt. And we'll talk a little bit about that, in particular in relation to night shift workers, that oftentimes will develop a chronic sleep debt problem. The actual equation in terms of what the definition is of sleep debt, it's just simply the amount of sleep that you should be getting less the amount of sleep you actually get. So if I require 8 hours of sleep in order to feel restored, and I'm only getting 6 hours of sleep, I'm incurring a 2-hour sleep debt every night. Next slide. So sleep and sleep debt, it adversely impacts performance. Sleep debt causes fatigue. Fatigue impacts performance. And that's across all shift work professions, not just nursing. Older workers, I think we all acknowledge that older individuals in general tend to have a higher propensity for sleep disorders. Well, certainly older workers doing shift work are prone to sleep disorders, and I would be remiss if I didn't bring to everyone's attention the fact that we have an aging nursing population. So a large number of nurses working shift work are skewed to the older side of the scale, and therefore are increasingly at risk for sleep debt. This last statistic here, I think, is absolutely enlightening. I cannot tell you until I ran across this that this had really registered with me, that commute time impacts a staff member's ability to obtain sleep. And actually, it's been proven out here through a very comprehensive and large study by Allen that every minute of commute time equals 0.84 minutes of sleep loss. So take a minute to digest that. If I have an employee who is commuting 1 hour to and from work, so 2-hour commute time, they're losing, according to this, approximately 0.84 minutes of sleep for every minute of commute time. They're probably losing about an hour and a half of sleep time a day, just simply by virtue of their commute time. Something we probably have not taken into consideration when we're building staff schedules. Next slide. So there's actually an official disorder called shift work sleep disorder. It is a part of the International Classification of Diseases, the most recent version, version 10, actually called circadian rhythm sleep disorder of the shift work type. So basically the definition is a normal pattern of sleep and wake cycles that conflicts with the shift work that the person is being asked to perform. Most at risk for sleep work, shift work sleep disorder are permanent night shift workers, and they are critical to the management of our nursing units. What would we do without those who choose to work what many would consider the unpopular night shift? And any schedule with a night shift rotation. So even if you're not a permanent night shift worker, if you are picking up a night shift, then you also are at a higher risk. A very comprehensive study by Flo and others of over 5,000 nurses actually was able to identify that in that group of 5,000 nurses, over 37% actually fulfilled the official criteria for a diagnosis of shift work sleep disorder. So I think that really took me back when I realized how pervasive this problem is. Next slide. So let's look at some data. I think this will interest you. It certainly piqued my interest. Next slide. I had an opportunity to do some research work related to fatigue. And I want to share with you some highlights from the results of what I found in doing that work. First of all, there is a tool, a legitimate tool called a fatigue index score calculator from the Health and Safety Executive. The Health and Safety Executive is actually a branch of the British government, and they had commissioned the development of this tool, and the tool is used across many professions, not just healthcare, but it has been used extensively by the nursing arm of the Health and Safety Executive in the United Kingdom. The tool's been validated both with the Karolinska sleepiness score and using EEG readouts. So it is a valid tool in terms of understanding what the probability of fatigue is on a daily basis for a shift work schedule. So I took this particular tool, and next slide, please, and took a look at a sampling of shift work schedules over a 4-week period on a variety of medical surgical units in an acute care hospital in the southeast part of the country. This particular organization had just 12-hour shifts, so we were just looking at 12-hour shift schedules over the 4-week period. In looking at 379 actual events, some very interesting statistics became apparent. For the day shift, the highest score that ever appeared in terms of the probability that a day shift nurse would be fatigued was 20%, 20.7% probability of fatigue on the 4th consecutive 12-hour shift. So it tells me that, yeah, working day shift is fatiguing, but probably not overwhelmingly fatiguing, though I guess if you flip that number around, you could say that 2 out of every 10 nurses on the 4th consecutive 12-hour day shift have some degree of fatigue. What really was alarming to me was looking at the night shift. The lowest score, the lowest probability of fatigue for a night shift worker occurred on the first night after coming on after a significant rest period. So you would assume that this is going to be the time when this night shift worker is probably the most alert, coming off of a couple of days of rest. So the lowest score on the first night that the nurse works is 42.3%. So we're talking about almost half of the nurses coming on to the first night of a night shift run are fatigued, have some high level of probability of fatigue. The highest score in this particular data set, not to say that there would not be a higher score if in a larger data set, but the highest score was 59.8%, and that was on the 5th consecutive 12-hour shift. So what we're saying here is that 6 out of 10 nurses on the 5th consecutive 12-hour night shift, it's not like they've developed a pattern and a comfort level with having flipped their circadian rhythm to the night shift. They are 60% likely probability of fatigue on the 5th consecutive night shift. And this is going to be important because when we look at defined periods of time when we're scheduling, we're most often looking at what are pay periods. And when you have 2 pay periods bump up against each other, it is very easy to go beyond 4, 5, 6 consecutive shifts as you transfer from one pay period to the next pay period. So very interesting data, some of it alarming as far as the night shift probability of fatigue for those nurses. Next slide. So let's talk about this shift work based fatigue and leading to burnout. So shift work and sleep disturbance, these are both proven antecedents to stress. So, and they don't need to be combined, but shift work and sleep disturbance definitely lead to some levels of stress in our staff. In nurses, the fatigue that results from stress, we normally refer to as burnout. So there are a sequence of events here that I want to point out. We start with shift work. We have a shift work profession. We know that this is causing sleep debt to be incurred in some of our staff, if not all. We know that sleep debt leads to fatigue and stress are hand in hand, go hand in hand. And we know that fatigue and stress ultimately lead to burnout. So what really then is the role here in terms of work schedule induced fatigue? Many things fatigue our staff, but rarely have we considered the fact that the way I'm scheduling them is actually adding to the likelihood of fatigue for the staff. Next slide. So we've talked a lot about this, the nurse and the staff. Let's not forget the patient. I would be remiss to have this conversation and not also shed light on the patient. Next slide. So I think it probably goes without saying that the most alarming negative impact of fatigue is decrements in performance on the part of the nurse and decision regret that impacts the care that the patient receives. And I think decision regret is a really, really important thing to point out. It's not always that I did something wrong or that my performance was poor, but oftentimes is I am concerned about the quality of this decision I made in providing care. So in a study of over 500 nurses in the US, 30% reported decision regret at some point in time. And it just so happens that those that did report decision regret also reported increased amounts of fatigue. So the two seem to go hand in hand. Next slide. And work schedules have also been associated with something as severe as patient mortality. Dr. Trinkoff, who is a very well-known researcher on the topic of fatigue in healthcare and scheduling, actually has a study that he reported pneumonia-related deaths were significantly higher when nurses reported long work hours or decreased amounts of time away from work. Decreased amounts of time away from work obviously associated with less sleep or restorative sleep opportunity. And fatigue associated with overtime work was associated with increased readmission rates. This, I think, was a very interesting study. The implication here was that on a nursing unit where there were large amounts of overtime, that there were higher readmission rates. And what was being inferred was that if the staff was working a lot of overtime, they were fatigued. And if the staff was fatigued, they probably were not doing as good a job as they would like to have done in terms of preparing patients for discharge and self-care. So patients were going home ill-prepared to care for themselves and ended up coming back within a 30-day period of time, which we know also not only is that not good for the patient, but it certainly is not good for the organization with the financial impacts that that type of behavior can have on an organization. Next slide. So work schedules matter. I mean, that's the big message here is shift work leads to sleep debt, which leads to fatigue and stress, which converts to burnout. When a nurse is burnt out, there's an adverse impact on care, which then feeds back into the stress cycle. It's a spiral downward in terms of burnout. So let's talk a little bit about fatigue and engagement. Next slide. Polar opposites, engagement and fatigue, burnout. If you have an engaged employee, an engaged workforce, you're talking about individuals that are energized. They are involved in their work. There is a sense of competency in what they are doing. There's joy in work. If you are talking the polar opposite with fatigue and burnout, you're talking about an employee that is exhausted. This employee is being drained by the work. There's a sense of depersonalization. I don't matter. And there certainly is a sense of a reduction in a sense of personal accomplishment on the part of that employee. So certainly fatigue and engagement, there is a relationship here. Let's go to the next slide, please. So work schedule induced fatigue. So how does this really adversely impact engagement? There are really three ways that a work schedule that is poorly designed, that is increasing the level of fatigue in their staff, adversely impacts their ability to be an engaged employee. The first is in exhaustion. What you'll see here are withdrawal behaviors on the part of the staff member. They are being drained by work and therefore are pulling back and pulling away from work. The sense of depersonalization that a poorly designed schedule that induces fatigue can have, it gives the employee a feeling of being taken for granted. No one cares about what's happening to me here in terms of my work schedule. I'm unimportant. My personal needs are of less significance. And I have a sense of being apart from the group, apart from the organization. And the third way that a poorly designed schedule adversely impacts on engagement is this reduction in personal accomplishment. If I'm not feeling good about what I'm doing, if I'm not energized by what I'm doing, if I feel as though I'm being taken advantage of, I have a real decreased ability to believe in my own self-confidence. I question my competence. I have fear of errors, decision regret. So anything that adversely impacts the schedule, induces fatigue, it automatically adversely impacts engagement. It's a matter of, over a long period of time, is this or is this not reversible? Next slide. So resulting behaviors. What happens when this is happening to one of your employees? When you are actually, certainly not intentionally, but unintentionally, developing schedules that are adversely impacting that employee. You see these behaviors beginning to show up with withdrawal, exhaustion, depersonalization. Well, what else are you going to be, or should you be tuned into to identify if you have this problem going on? There are really three things that stand out for me. One is absenteeism, that we should be monitoring absenteeism. There's relationship between shift work and absenteeism in general, and certainly physical fatigue is associated with absenteeism. So if I see a particular employee whose absence seems to be trending in the wrong direction, it may be a question I want to ask as to what role does the work schedule have in what's happening to this employee. Certainly there are many other things that could be affecting that employee, but I think we do need to step back and consider what impact the work schedule is having. And absenteeism also has an adverse impact not only on patient care, but on the organization as a whole in terms of financial performance. There is a financial cost to absenteeism, as there is with turnover. And we certainly know that the cost of turnover is significant. And turnover, though never desirable or only desirable in some cases, I guess you'd say, is something we need to be very concerned about with the current nursing shortage. That the ability to fill that open position is diminishing over time and probably will be severely impacted over the next 4 to 5 years as we go through the very worst of the current nursing shortage. So fatigue and exhaustion were among the top reasons in general for employees leaving an organization, that those were real motivators to move on to another position. And then we have our performance decrements, whether employees that are not engaged or are fatigued and burnt out, they have diminished attention to detail. They don't trust themselves anymore. They don't feel competent. They're error prone. So these are behaviors that I would say that we, number one, always need to be looking to identify if we have trends in this area, but we also need to consider what role perhaps is the work schedule playing in supporting these unfortunate events. Next slide. So diminishing work schedule induced fatigue. Next slide. What is it that we can do about this? Now, I will tell you that there is no magic bullet here, but we certainly need to tune into the impact that the work schedule has on some behaviors in the workplace, and there are some things that we can do. The first, and I think the most important thing in terms of staff scheduling, is to clearly articulate rules. I think it behooves us to sit down and actually sketch out what really are the boundaries. What do we consider acceptable and unacceptable in terms of work schedule development? What are our expectations of our staff? It can't be just a blank piece of paper and I'm filling in the squares. I need to have specific rules that a bar that I set, that I challenge myself to achieve that level of care of both my patients and of my staff. Based on the data that I look at on a pretty regular basis in light of the type of work I do, I would highly recommend that if you do need to continue to use 12-hour shifts, and here, you know, the evidence tells us clearly that this is not a good thing to do, and all of us want to say that we believe in evidence-based practice. But I think we have to acknowledge the fact that the evidence is telling us something and we are not responding. But we are not responding for sometimes very legitimate reasons, and we do need to acknowledge that also. There are forces within the industry now that are interfering with our actually practicing evidence-based medicine, evidence-based nursing care in relation to work schedules. So if you have to continue to use the 12-hour shifts for whatever reasons in your particular circumstances, what I would recommend is that consecutive 12-hour day shifts really should not exceed 4. And give the nurse an opportunity for some restorative and sleep, and hope that that nurse takes that opportunity and is not working another job or adding extra hours. For consecutive 12-hour night shifts, they should not exceed 3. The evidence is clear that the magnitude of the probability of fatigue for that nurse is significant. Those would be my top line recommendations in terms of how to use 12-hour shifts with the least likelihood of a problem. I would also recommend that we create a culture of openness and encourage reporting excessive fatigue. Fatigue is a significant problem. It is not something that should be swept under the rug. An individual who is fatigued should not be admonished, but it should be acknowledged that there is a problem there. We should investigate and see how we can help that individual. We should care enough on the nursing units about one another to create a culture where we are concerned about each other's ability to perform to the best of our ability. So I would encourage creating a culture of openness, encourage reporting, have the issue of fatigue discussed at staff meetings, have people be open about the challenges they have in getting enough restorative sleep. Night shift nurses should be closely monitored for signs of fatigue, and I believe that's everyone on the unit's responsibility. Particularly, that is the manager's responsibility, is to be tuned in and continually take the pulse of those night shift workers with the highest probability for fatigue. I would also say that there probably should be plans in place to address fatigue, in particular in the night shift worker. You know, I think in healthcare, we're very good at rewarding people for, you know, positive behaviors or smiling or saying please and thank you. I think we need to have a plan in place when I come into work in the morning and I see that there's a member of my night shift team who does not look capable of safely driving home. Drowsy driving is a huge problem for night shift workers. What is my plan and responsibility as a manager to address that problem for that nurse? Do I have a voucher system where I can send that nurse home in a cab? Do I have a place where I can send that nurse to get a couple of hours sleep before she or he gets behind the wheel? I think we do need to have plans for how do we address fatigue once we identify it. Commute time matters. Surprise to me, but now that I know it, I'm preaching it to the industry. It matters when you're creating a work schedule to have some sense of the challenges that your employee has. And if you have an employee that travels long distances, certainly in some of our rural communities, we have employees that travel very long distances. But even in our large cities, commute times can be significant. And what impact does that have? And is the person with the long commute time an older member of the staff who also has some sleep disorder challenges? So we need to factor in how we're scheduling these folks with those types of things under consideration. Know if you can, if your employee has a second job. I know that's asking a lot, but what that means is knowing your employee and getting a sense of, is this person working across town on the days that they're not working for me? And also know if your employees are working overtime in other departments within your own organization. Probably the best way to know that is through automated systems that can alert you to the fact that though an employee may work full-time for you, that the automated system is picking up on their time card or on their schedule that they're also working an extra shift, you know, 3 floors up. But get to know your employees. I would also note here that in an age where we have both centralized and decentralized staffing and scheduling approaches, that in a centralized staffing approach, it is difficult for a centralized staffing office to get to know the details behind each employee's circumstance. And it therefore rests on the shoulders of the manager to ensure that the centralized staffing office is overseen by the manager who understands what those employees, what their personal needs are. So centralized staffing doesn't mean managers abdicate responsibility in terms of staffing and scheduling. Next slide. So to sum up here, what hopefully we've learned today and we can improve tomorrow, shift work schedule creation is where quality care begins. So it doesn't begin when the nurse hits the floor. Quality care begins when we actually deploy the workforce or plan the deployment of the workforce. We recognize that there are 3 behaviors associated with disengagement, and we need to watch out for and make sure that we're not adding to the burden that causes exhaustion that's exhibited by withdrawal on the part of our employees, that there is not this depersonalization that's exhibited by a sense of an employee pulling away from or having a sense of being apart from the group or the organization, and that a reduction in a feeling of personal accomplishment. If we have an employee that was once very confident, very competent in their work, and we find that they are becoming indecisive, they're unsure, that probably is a red flag that we need to step back and ask ourselves. There could be many reasons for that happening, but is the way I'm scheduling this employee also causing that to be a problem? And we need to reevaluate scheduling creation practices. So I would highly recommend that everyone step back and ensure that you have clear guidelines for shift lengths, what you are willing to and not willing to accept, to ensure that there are clear guidelines for the number of consecutive shifts and how they're rotated, forward or backward. Should be rotated forward if you're still rotating shifts. And that nurses on permanent night shift and those rotating to nights should be carefully monitored for fatigue, and that is everyone's responsibility. And they should be comfortable in acknowledging if they are experiencing fatigue. That should not be something that is hidden from the manager or their coworkers. Next slide. And that concludes my remarks for the webinar today. I hope that you have found this information interesting. I hope you found it valuable, perhaps enlightening. I certainly am continually learning and appreciating the role that work scheduling has in both the protection of the nurse and the protection of the patient. And I am happy to address any questions. I believe that there's a chat box that you would be able to submit a question if you have one.
Hi, yes, thank you so much, Susan, for that fantastic presentation. At this time, we will begin the Q&A portion of our webinar. As a reminder, as Susan just said, you can submit questions by typing them into your control panel in the section labeled Enter a Question for Staff and clicking Send. So one of our first questions today, Susan, how do you know what a commute time is? Do you create a mandatory form to let the manager know?
So I would say there are probably a couple of ways that you could do that. One is just simply having a good enough relationship with your employees to have that discussion about how are you, most of the time I think managers know how a person is getting to work. Are they driving to work? Are they taking the train? Are they being dropped off? Are they carpooling? But being close enough to your employees to understand how they are getting to work and what their challenges might be. But straight out asking the employee how long it's taking them to get to work. You know, probably the least interpersonal would be doing something as simple as simply Googling their address in relation to the organization and getting some sense of what the distance is, and then try and find out what the mode of transportation is that they're using.
That's very helpful. Thank you very much, Susan. We have another audience member who wants to know if you think that it's better for staff to work night shifts straight through, or if it's better for them to flip-flop day and night shifts.
I think my experience in talking with night shift workers is that it usually is easiest if they can be consistent, that they make their flip over to the night shift, they work their 3 consecutive nights, and then have a significant period of rest between the next series of night shifts. The changing your wake-sleep times around the clock is very, very difficult. So I think organizations that in the past have rotated days, evenings, and nights would recognize that. Now, having said that, there's evidence out there that it is easier for a younger worker to do that than it is for an older worker. So I think that would also factor into it. I certainly would not want to challenge an older worker with those kinds of in-the-moment time changes.
Great, thanks for pointing that out. So our next question today is regarding workplace culture. Susan, how can you create a culture of openness about fatigue?
I think that is critical in work scheduling. And I think it starts with the manager being open about it, bringing it up in staff meetings, not chastising individuals that appear to be fatigued. It needs to be open and acceptable to have the conversation. A staff nurse should be able to go to a manager and very clearly articulate the fact that, the last work schedule that you wrote for me was almost undoable for me, and this is why, or to accept or to be able to explain what their challenges are outside of the workplace and work with that employee to come up with a work schedule that, we talk about this work-life balance, we really talking about creating a work schedule that works for both the employee and the employer. So I think it needs to be acceptable to have that conversation. I shouldn't have to hide from my manager that I'm in trouble here.
That makes a lot of sense. Thank you for clarifying. We have another audience member here who is curious about some of the data that was presented. Related to the data quantifying fatigue to consecutive night shifts and then 2 days off, was there a recommendation about the optimal number of days off?
There was not, actually. Having said that, it needs to be more than 1 day off. So the data showed that 1 24-hour period off is usually not sufficient for a night shift worker who works 3 consecutive, has 1 night off, and then comes back again. There need to be longer rest periods for night shift workers. For day shift workers, a 1-night break is sufficient.
Great, thank you for that. Another question here, is there any comparative analysis between 8-hour shifts and 12-hour shifts, specifically with respect to work schedule induced fatigue and patient outcomes?
So, the data that I presented to you in this webinar was just looking specifically at 12-hour shifts. That the particular organization where that data was collected only has 12-hour shifts. I would say that that is the next piece of investigation that needs to occur, is to see if we can find an organization that either has a combination of 8 and 12s, so we can further evaluate the impact of 8-hour shifts as far as probability of fatigue, or ideally if we could find an organization that had nothing but 8-hour shifts. I think that probably we'd be hard pressed to find that. But I think that's the next area of inquiry. Very, very good question though.
Right, that's really interesting. So we have another question here regarding the future of recruitment. So how do you believe this discussion around work fatigue and work schedule induced fatigue is going to impact the future recruitment qualified individuals?
So, I think, again, it's an openness issue. I think that the generation coming into the nursing profession or having recently come into the nursing profession is usually pretty upfront about what their expectations are and what works for them and what doesn't work for them in terms of work scheduling. So I think it goes back then again to openness. I think it probably should be part of the recruitment process, is to talk to a potential candidate about what the expectations are in the organization, how that does or doesn't fit with their expectations. We're coming to a point in time too where many may have heard the term gig economy, where the younger workers coming into the workforce today have a mentality of not necessarily tying themselves closely to an employer in a full-time position, but they work gigs. Very much like an agency nurse would, or a float pool nurse, where they work when they want, where they want. So it's a whole different generation we're going to be dealing with in terms of how do we schedule and staff. And that's our next challenge.
That's very insightful. So it looks like we have about time for one more question here, Susan.
Right.
Our last question will be, what if nurses are picking up shifts on other units?
Yes, so really, really important. Really hard to track that in an organization that does not use automation well. If you're still doing things manually in terms of tracking where folks are working, you probably don't know that happened until a payroll is generated, and all of a sudden you realize that, well, that 40-hour employee on my unit worked 16 hours on someone else's unit and now was in an overtime situation, number one, so there's a financial impact, but number two, I, on my unit, had no idea that this nurse was working more than I was scheduling her for. So automation definitely can help with that in a couple of ways. Certainly electronic time and attendance tools actually monitor where employees are and what their accrued hours are at any given point in time. Automated scheduling solutions these days also have the ability to alert you on a proactive basis to an employee who's about to go into overtime. So if I have a full-time employee on my unit, I've scheduled that employee for full-time hours. We're only halfway through the pay period, and I get an alert that says, Mary Jo is about to go into overtime, Susan. That is my first alert that Mary Jo is working someplace else because she's only worked half the hours I've scheduled her for so far. So automated solutions, that's the value in automation, is that, the days of us serving the software are over. And what our expectation of software should be today is, what is the software doing to make my job easier? So it should be serving up to me information that will alert me to my need to intervene. So this is the next generation of software and how we're using it.
All right, so that looks like we have all the time we have for today. Again, I just want to thank you, Susan, for your excellent presentation, and also thanks to our audience for participating today. Enjoy the rest of your day, everyone, and we look forward to having you join us for future webinars.
Thank you very much. It was a pleasure.